Good morning. I'm Angela Morton with Recovery as Community NWPA grant projects in Venango, Crawford, and rural Erie counties. I'm here today with Brittany Salerno, a harm reduction advocate who works in the Philadelphia area and has a lot of experience in areas outside of Philly as well. So welcome, Brittany. Thanks for chatting with us today.
Thank you so much for having me.
When I asked you to be part of the, we call this the Recovery Is video series, and we've had lots of good chats, several good conversations, and we'll have to loop back around and kind of carve down what we're going to talk about. But we are trying to bring awareness to issues around drugs and alcohol and helping people get better access to services and to reduce judgment and reduce stigma about substance use disorder, anybody who is using drugs or alcohol or struggling with a substance use disorder. So tell me about your work in Philly and how it translates across the region in your harm reduction sphere.
Absolutely. So I do work in Philadelphia currently. I just received my Master's of Public Health from Penn. I've been involved in harm reduction advocacy in Philadelphia and regional counties for about 6 years now. I am from Montgomery County, and my network expands much further because I was inspired to get into this space, as so many of my classmates that I went to school with, friends of family members, things of that, have been impacted negatively because of our current drug market and because of not really knowing where to turn for help, as well as not really understanding the risks associated with their drug use. There's many reasons for that. We can save that for another conversation, but being a family member myself, I was compelled to help in some way spread better awareness, not just awareness, because I do believe we're all plenty aware of what's going on. We have to take it a step further and think, how can we be a part of the change? So that is what's inspired me now that I work in Philadelphia, which is a whole different ballgame than many of our regional counties. I have been able to be an advocate in the emergency department for culture change, which is so great, especially for people who use drugs in this city, especially. So many people that are currently living in Philadelphia, experiencing homelessness, anything of that nature, they didn't start in Philadelphia. They started in other counties, and it has just either migrated over or they're stuck here. They don't have the resources to get back home. Perhaps their resources are incredibly limited at home. And I think a lot of people will be like, well, to just let them stay there, right? Let them get help there. And I think that's really harmful context to think, because that's othering people. And when we other people, that's stigmatizing, because at this rate, we all know someone. Your neighbor has a son or a daughter, or your coworker's mom or father. Everyone knows someone who has died of an overdose or is currently struggling. And I think we need to keep that in mind whenever we may be utilizing our knee-jerk reaction to pass judgment on someone else's struggle.
Thank you for saying that. It's so important for us to weave that into every conversation we have that involves substance use, drugs, alcohol. And you said something about culture change. And we don't talk enough about that, but let's talk just for a minute about what exactly that means. We can make changes, but to change an actual culture, just the environment in a community or in an emergency department, we do a lot of that work in our grant work in this region too, because we know that if people don't feel comfortable in an environment, they're not going to be able to come forward and say, I'd like to talk about what's happening with me and maybe I need some help. So tell me a little more about what it means, just in basic terms, culture change.
Absolutely. So culture change impacts just the way we experience the world, whether we are a privileged individual or not so privileged individual. A very easy way to demonstrate culture change is by, one, recognizing that some things have been harmful for select individuals. Just recognize it, acknowledge that people have not been treated fairly, right? And then we can take it a step further and understand that the language that we use matters. By reducing stigma, we can use person-first language. A lot of individuals may think, they call it oversensitivity, right? Oh, you're just being oversensitive by the language that you're using. And I like to push back and say, I think we're all just learning and trying to do better. So rather than passing it off as being oversensitive, why don't we just collectively decide to do better? A way to do that is to use person first language when an individual is struggling, whether they have a physical disability, whether they use drugs, whether they're experiencing homelessness. Um, I really try to not use their condition as their label because at the end of the day, we're all people first and we're not defined by the things that we go through.
So give me an
Person,
example of that. I mean, even with a medical condition, when we say a person with diabetes versus a diabetic,
yeah.
right? Like anytime you're putting the ick on the end of, schizophrenic versus a person with schizophrenia.
I think it just classifies people as their condition and not that they're a human being first. So a person who uses drugs, that's what I prefer to use. I don't like using the word addict. A
Or
homeless
drug
person,
user.
drug user,
That even
yeah.
has a negative tone.
Exactly. A person who faces homelessness over a homeless person or a bum, right? It takes a lot of awareness to kind of see where we have participated in this, and it's okay. It's okay if we've used the wrong words before, but maybe if we could just try to do better and be a little bit more conscious moving forward, that's how culture change can happen. In the hospital setting, it's been incredibly important for this select portion of people. If someone doesn't feel safe coming into a space, they're not going to access care. And accessing care is so incredibly important because it's not just an individual accessing care, whether it's wound care, whether it's they think that they have COVID, whether it's to seek treatment for their substance use if they're using chaotically. They can't, that the system is broke if they don't feel safe going to access it, right? And
Absolutely.
so
If you can't go somewhere to say, I'm struggling or I need help, where the place you should be able to go is to go into a hospital and say something is wrong. Maybe you don't even know what withdrawal is, or maybe you don't know what's happening, but you know something's wrong. We should be able to walk into that space and easily access help, right?
exactly.
Like that's kind of the main message is we want to create environments where people can turn to each other and go to places that they can ask for services when they need them and when they choose to.
Absolutely. And culture change is slow, especially in older systems like a hospital. And I can speak firsthand to this. I've been working in the emergency department coming up on 4 years now, which is unbelievable. Um, and we are very compassionate collectively to people who use drugs. I have a team of wonderful advocates. If we know a community member is coming in, I strive to meet them at the door so they don't have to go through security by themselves, which can be triggering for individuals that maybe experienced incarceration or I don't even like going through security. Like I go through TSA and my anxiety is heightened, right? So kind of just understanding how we experience things and recognizing that it's no different, if not probably more exemplified for other people. Um, to now we're at a point in the hospital to where my patients tell me I've never received this kind of care before. I've never had somebody go out of their way to bring me a blanket and to not make me feel gross because they have had experiences to where they have felt their doctors, their nurses don't want to take care of them because they're dirty, because maybe they're facing homelessness, which I think is incredibly, incredibly important to recognize. A lot of people experience this.
It is really important. And do you think it's as important or could be as important to teach each other, to teach people how to advocate for themselves? Because I know sometimes, as you and I were talking about, we're in the system and we know where the help is. So when somebody reaches out to say, hey, my family member is struggling or somebody I know is struggling, where do I turn? It sometimes is really challenging to get connected to those services. So do you think it's important for people to understand the even just the condition of substance use disorder so people know this is a real thing. You have a condition and this struggle that you're feeling, it's very real and help is available, treatment is available, recovery is possible so that they can walk into a situation and say, I think I have a substance use disorder, or I think that something is wrong because I've been using drugs or drinking a lot or whatever substance, and feeling comfortable saying, I need to advocate for myself. I know something's wrong and I need some help.
Absolutely. I think self-advocacy is incredibly important. I will say it's difficult, especially in systems where people don't always feel safe. And I like that you brought into the fact of a family member. I do want to touch on the fact that many family members experience stigma and are afraid to recognize the reality of what their experiences is. I'm a family member myself. I was never quite ashamed of the person that I loved, but I was more nervous about the perceptions of other people around me and how they were going to view the person that I cared about because they were struggling. So I do want to just give credit to that. Knowing where to turn is incredibly difficult. And it seems as though we as professionals need to do a better job at increasing low barrier access to care, because everybody can say they just need to go to treatment, they just need help. It's not that easy. It's incredibly complicated. It comes down to the money that you have, the insurance that you have. Do you have an address? Do you have a cell phone for a doctor to be able to call you back? So many things that we take advantage of on a daily basis can greatly impact the way other people are able to access their care.
That's a really good point. And I think for anybody who's listening and maybe thinking, okay, you just talked about low access care, where do I get help? And I always wrap up with where you can get help. But just because we're talking about it, um, treatment is available regardless of ability to pay. And we really try to put that out there on all of our materials, websites, everything we have. Treatment is available, even if you don't have insurance and you can't pay, because you can usually go through your county. There's some behavioral health managed care that can cover the services. So either call the back of the card that you have. If you have an access card or an insurance card, call the back of the card and ask what your options are. Or you can call your county across the state of Pennsylvania, or anywhere that someone's listening. You can call your county office to ask for drug and alcohol services. They can get a person connected. So that's one phone call. You're not committing to treatment at that point. You're just calling and asking some questions and advocating for yourself.
Yes. And so many people don't know their options for care because they may not understand their personal risk associated with what they're doing. And that's something I experience a lot with people who maybe have been struggling for most of their life. I hear many people that say, I just need to go away. And what that means in the context of our community members is I need to go to a 30-day treatment. I need to come off of everything and I will be better. And what I often do is I sit with them and I say, well, how has this worked for you in the past? What has worked for you? What has not worked for you? And understanding that in early stages of recovery, especially medications for opiate use, if you're using opiates, is so incredibly important because of the current drug supply that we are faced with. When individuals aren't on methadone or prescribed Suboxone, in at least the early stages of their recovery, they are in a high risk window to potentially experience an overdose. And so many people, drug users and family members and community members, aren't aware of overdose risk and how it can happen anywhere.
And especially for someone who's had a period of abstinence, like while incarcerated or in a rehab, having a period of abstaining from using any drugs or alcohol and then returning to use can be very dangerous in terms of overdose risk too, right?
Correct. Almost every single friend that I have lost to a fatal overdose, it was a return to use after a period of abstinence, whether they were in recovery in a recovery house and went to go use. A lot of people use drugs as a coping mechanism. Granted, it may not always be a positive coping mechanism because of the harms that it causes people, but that is what they have access to.
And if you've been accustomed to using something to either feel or make those feelings go away or to deal with trauma memories, there are many reasons that people choose to use drugs or alcohol to cope. And when you're used to doing that, and then somebody says, we're just going to have you do a 180 and live your life differently now, it can be really challenging. As you said, particularly in early recovery. So making sure that people have supports and connections in order to continue on that path of recovery, whatever it looks like, is really critical, don't you think?
Absolutely. And just understanding that recovery is not a straight line. It's a squiggly, messy line, and that's okay. Um, the goal is to keep you as safe as possible. And that's what I do as a harm reduction advocate. It's about reducing harms. If people are using drugs, if people do return to using drugs as a community member, how can we reduce harms for this specific population of people?
Not just for individuals, though, right? We are focused individually on the people we work with in the moment, but you and I have talked a lot about how that translates into families and into society. And sometimes when people maybe say, I can't relate, I don't know anybody struggling with that, but I know it's a problem, it is a bigger problem. It's not just about individuals who may be navigating those waters, but the family members, the smaller communities and larger society are also looking at how can we reduce harm? How can we reduce infectious disease? How can we make sure people don't die? Because, as you've said, somebody who dies doesn't even have a chance at recovering.
Exactly. Dead people can't recover. And it's not just personal, individual health of these individuals, it's now a public health issue. Over 100,000 people died last year alone in the United States of an opioid related overdose death. That's unacceptable. It's
It is.
unacceptable.
And those numbers don't discriminate. There are a wide array of ages, including teens, adolescents, young adults, elderly, that it's not just a certain population that happened to. It's the entire population. It can happen to anyone.
Exactly. And just because people in your community may not be talking about it out of fear of judgment doesn't mean it's not happening. People die of an overdose because they're alone and no one is there to help them, and no one is there to help them with the ways that they can be helped. Very easy way would be to just keep Narcan in your car or in your purse. We are all first responders at this point. It's not just a Philadelphia issue, it's a regional issue. And just because people aren't talking about it doesn't mean it's not happening. So I want to go back to the mitigating stigma conversation. The language that you're using, you don't know who else is in the room that is listening to you speak poorly about the person that they love. Your neighbor, your mom, your colleague. It's very important and it's very, very real, whether we want to admit it or not.
It is. And you notice that I often say we as if it could be me, it could be you. We don't know. So I try to refrain and try to role model not ever using the words those people or these people, because those people could be me and it could be you and those we love. So that language and that attitude really does matter in terms of increasing access to, as you said, low barrier care. Let's reduce the barriers. Let's find ways to alleviate the housing, the transportation, the childcare concerns that people face. They're maybe getting to treatment, trying to get harm reduction resources or recovery supports, but can't physically even get there. Or maybe they don't have the financial means to work to get the to get some clothing, to go to the interviews, to get a job. So it all has to start somewhere. And it's a big picture of ways that we can work together to have an impact.
Exactly. That was very well said. It's a trajectory, right? If we can't
It
increase
is.
access to care in the beginning and make people feel safe and as if care is possible for them, nothing else will follow.
And thank you for your experience and sharing all of that. And you and I, we said we wanted to make sure and mention that Narcan, if somebody says, well, where do I get it? It's a small nasal spray. It's easy to carry. It's available at pharmacies across Pennsylvania and probably nationally, but there's a standing order in Pennsylvania for all pharmacies that you can just say, can I have Narcan? And you can either run it through your insurance or it's often available for free. It's also available at the county drug and alcohol offices. So you can call and say, can I get some free Narcan? I want to keep it on hand for myself or my family, and just keep talking about it. So we normalize it and no longer have to deal with the stigma and people having to be afraid to access services. So on that note, I want to make sure people know to call their local county or to call the national SAMHSA hotline, which is 1-800-662-HELP. And that you would just ask, it's going to say, do you have a mental health or a substance use concern? It's automated. You click the button, you'll get a human being who helps you navigate what county you're in and where you can get some services. And you can also call the back of your card. Treatment is available regardless of ability to pay. You can also visit our project website. It is recoveryisnwpa.org. And there's one button says if you need help, and the other is if you'd like to help. So you can get involved and support the work that we're doing on the grant projects. So thanks again, Brittany, and thank you for joining Recovery Is.
Thank you. Thank you so much for having me and the work that you do. So important.